Hey, Catalina Foothills Church. It's Pastor John Stone here in his kitchen. And as you know, I have the coronavirus. I was diagnosed, or I got the positive test last Thursday. Marissa and I went out to eat dinner Wednesday night, and I felt terrible. And in God's good providence, we got seated in a restaurant where there was no one else. It's crazy. And I've been home since. So the way the coronavirus has hit me is that I've had a lot of body aches, big headaches, a little bit of fever. I can still taste, I can still smell, but it's really cycled for me. So like Wednesday, Thursday, Friday, Thursday, Friday, and Saturday were pretty hard. A lot of aches, a lot of headaches. I would have good hours, 4 or 5 hours, and then 4 or 5 bad hours. It seemed like the morning was good, the afternoon was bad, the evening was worse. That was true all the way through Saturday. I did get to watch every stroke of the Masters. That's a positive. Sunday, yesterday was okay. Today's better. I still feel sick. I'm on the right medications. I'm thankful to Dr. Rob Dean, who's really walked me through this. Marissa's here with me. She's quarantined. She's shown no symptoms. Wonder Woman never gets sick and doesn't believe in sickness anyway. So, some people can't get the coronavirus. John Miller also has gotten it on our staff. So here's what we want you to know when someone in our church gets it. Both in my case and in John's case, those who are in close proximity to them, we contacted them. We're having our whole staff tested. We had most of them tested today. The rest of them will be tested tomorrow. We've had no more positive tests. Most people are coming up negative. So if you've come to church and you've been exposed to the coronavirus and we know it, we tell you. When we came back, we had a masked service and an unmasked service. And the masked service only had about 30 to 40 people come in. The unmasked service had a lot of people. So we've evolved into this sort of hybrid method. And we are not saying it's safe where people in the front don't have masks and people in the back have masks and are distanced. We know that's not ideal. We know this has been very difficult. We wish we could be all back together. But until there's a vaccine people trust, until there's herd immunity, until there's better treatment protocols, we can't make the church safe. But it's important for you to know that we know people have had coronavirus in our congregation. Maybe 30 members have, but we're not like a planned community where people can report what's happened. If people tell us, we pray for them. We'll try to start making known through various outlets, hey, we know some members have had it this week, but remember, coronavirus is in our church. It has been since day one. We had one of the first victims in the county pass away. We had some children who had it before that who've come up with the antibodies. It's been in there the whole time. As far as we know, no one has come to worship with it. We really don't think anyone has showed up with worship, had it, and spread it. If they did, we would tell you. We've not had anyone say, hey, I was in church yesterday, I just tested positive. We would immediately send out an email telling you. So we would inform you about that. The way we find out that people have had coronavirus is Facebook, Twitter, word of mouth, prayer request. And so while we meet in this way, it's not safe for people at risk, older people who have pre-existing conditions to come. It's not safe. It's much safer for younger people. It's not having the impact on younger people. Every time you try to say that, somebody comes up with a story, but the statistics don't lie. Especially for people under 30 years of age, this has not been a disease which is causing either short-term or long-term problems. I know that everybody knows one person. I don't mean that sarcastically. That's not true. But statistically, it impacts almost no one under 30 years of age long-term. As you get older than 30, it has a bigger impact. As a 55-year-old, it's been a long go for me. But we can't give you a safe environment, meaning we clean it, we follow protocols, but there's a lot of people visiting the church. We don't know what they have when they come in. We don't know if they would contact us because they're new or visitors. We don't know that all members are watching this and will be aware, hey, if I have it, I need to call the church and let them know so they can notify people. We can't promise you a COVID-free environment in the same way that the supermarket cannot or a restaurant cannot. But we've had it, but we don't think we've had it in a worship service or in a Sunday school class or in a meeting where we are aware of it. If we have been aware of it, we've notified those people immediately, as we did those who were in contact with me and now those who have been in contact with John Miller. So as we go forward, you need to be the caretaker of your own health. There will be people with COVID. People in our church are going to get COVID. It's spiking again. You can't beat a virus. Everywhere I go, people are wearing masks. I know we're not wearing masks in the worship service. That's a decision we've made, and we've gently gone forward with that. But I didn't get it at church, so I must have gotten it somewhere in public, and I don't know where. I'm going to keep updating you on Sundays. I'll remind you. Somebody in our church this week got COVID, but I may not know who. It's not that you want to know the name like Bill Smith or Nancy so-and-so. I'm saying statistically, 700 people have regularly attended our church over the last 3 years. That means people are getting it, especially as it comes to the foothills and to Tucson in this second wave that we knew would come in the winter, and that people are going to have it. So if you're at risk, if you're older, stay home and watch it online. We're going to get better at streaming it. Yes, we know we have internet problems. Yes, it's been frustrating. We're in the process of getting fiber optics run to the church. We're in the process of doing a lot of things. But that'll take us a couple months. But it's not safe for people who are at high risk. It's not safe for them to go to the grocery store, for them to go to the doctor's office, for them to go to a restaurant. It's not safe to come to church where we sing, where we're tight, where there's a lot of people. I wish we could make it safer. We'll think about ways to possibly do that going forward. I'm sorry that we can't, and we're going to just work harder, but I want you to know members have had COVID. I have COVID. John Miller has COVID. Our staff has now been tested, is being tested even as this video is made. If we know someone has been in the presence if we know that one of you has been in the presence of someone with COVID, we definitely tell you. We don't tell names. It's just not proper to tell people's names. You don't want to know names. So if you've not been notified, we have no sense you've been exposed. But if you choose to come to church, even wearing a mask, we can't promise you an environment that's safe because no one can make you that promise. I wish we could. I look forward to the day when this is over. This is exhausting, but it's the world God has given us, and so we're going to love it. I had several people email me this morning. I called them on the phone. I emailed them back. They called me. I'm glad to talk about this. We don't have anything to hide. I know that people are always afraid to talk to the pastor. I'm stuck at home. I got time to talk. I just got off the phone with one of our members, older members, who's not ready to come back, and I get it. So call me, ask questions. But that's where we are. Pray for John Miller. Pray for me. Pray for everybody with COVID. Pray that this will pass. We love you. We miss you. We'll talk to you soon.